Good morning, my loves. Okay, today I'm actually not supposed to be smiling, but how you guys doing? I hope you're having a blessed day. Okay, I have a simple question. How do you guys get along with getting skincare recommendations from non-professionals? Or even, how do you survive going to people that you don't know whether they are professionals or not, but because they are expensive, you feel like they have your interest at heart? Now, I'm going to start this off with a story. I had a patient that walked in yesterday to get Oxyten, that's 10% benzoyl peroxide, and this lady's face was really messy. I had to stop and ask her a question. Hi, who recommended this for you? She said, my friend recommended it for me. And I'm like, she said I could use it to treat my acne. I said, okay, fine. Have you done this before? She said, no. I'm like, don't you think you should start with a lesser percentage? Like, there is 2.5% of benzoyl peroxide. There is 4%. Why are you starting at 10? She now said she doesn't know, that she has just been trying to treat her acne. And I got much more interested because almost her face was really messy. Like, and I said, okay, fine. Can you help me? Let's trace the cause of your acne. Did it start from when you were going into a lady, like an adolescent? Was that when it started? Like, let me know, because I really want to know. She now said no. She went for a facial session. The minute she said that, it caught my attention. Because one, I have about 4 different clients I'm treating their skin now. What's their problem? They went to clinics, aesthetic clinics. After their visit to aesthetic clinics, their issue started. Now, I got to know that these clinics actually, what they do is that they go on to use heavy chemicals on people's face. It's not chemical peel, no be chemical peel. These people go and combine it. Now, what these clinics do is that they mix a whole lot of chemicals and use on people's face. So you see that immediate glow you get. Now, you don't even know what they mix. Like, you know, I don't get that. You can just use normal clay mask, hydrators, and you will still get that glow. Or they just want you to have a lasting glow. They now mix a whole lot of things and use it, and you don't even ask. And if you guys know how much a session costs in Lagos, like, I had to ask the lady, how much did you pay for your face to be destroyed? Because I had to be very mean. She now said she paid 200k for a session, and they were still calling her after a week to come back for another one. And I was like, for real? She now said that they even gave her. And I said, let me see the products they gave you. In seeing the products that she was giving, like, I ran mad. Like, I literally ran mad. Like, come on. Do you guys even understand what it, like, the law of proportion when it comes to skincare? How to use ingredients, the chemical interaction between them, the adverse effects with overuse. Do they even understand? Like, I was asking myself this question, and I went to their page. This brand now, calm down. Let me calm down first, cause it's as if I'm getting angry on somebody's matter. But, like, to be very honest, guys, if you guys see the things on this product, I had to write it down because the picture is going to be, they can't really put it up, but I'll try and put it up. They gave her a wash. The wash was containing salicylic acid 2%, mandelic acid, glycolic acid, green tea. The toner is containing 2% salicylic acid again, 2.5% benzoyl peroxide, zinc gluconate. They gave her 2 things that were looking like lotion and serum. I don't know which one is which, to be very honest. One was containing 4% hydroquinone, 2% kojic, 0.1% dexamethasone, 0.05% tretinoin. The last product was containing aloe vera, squalane, glycerin, and 1% hydrocortisone. This last product is even the one myself I like. I might even recommend to someone because it's kind of soothing. Do you understand? But then, come on, this is one routine: a wash, a toner, serum, and lotion. There's no sunscreen given to her. Let me just assume they told her to please use a sunscreen. Now, sunscreen first, go do. Minus sunscreen. Do you know what is here? Do you know how many actives you have here? One face. Now, one face, they use mandelic acid, glycolic acid, 4% salicylic acid, benzoyl peroxide. One face. You gave all these chemical exfoliants to one person to use on one face. Are you not stripping the person? Like, you literally stripped the girls, but I thought they stripped your barrier. Before she even told, I thought that, like, they stripped your barrier. Because I have patients they did this thing to too, and they're trying to heal their barrier, like repair it and build it up now. Do you understand what a barrier means? Do you get? Or your stratum cornea be waiting. We have an acid mantle on our face. Now, every one of us, we have something called an acid mantle. Your acid mantle, more or less like the barrier on your face. Do you get? We have this. What this barrier does for us is that it tries to maintain the balance between the water and the oil on your face. Do you understand? It tries to maintain your face pH. It helps to like filter out toxins and pathogens from your face. Now imagine when it is compromised, when it has been stripped off, it can no longer filter all these things for you. What happens? Bacterial acne pass, you collect. Fungal acne pass, you collect. Hormonal acne come out, you collect. Overproduction of sebum, you collect. Anything that happens, you just be collecting left. I told her, I think what you need first, go and repair your barrier. I can't sell this thing to you. I know it's a loss on my own end because I didn't get the money, which my boss hears about. They might not like it, but I don't really care. When it comes to healthcare, the people's health comes first before the money. For Christ's sake, that is why we swear an oath, and that is why we have these licenses. You don't have the license for you to make money because, oh yes, it's a money milking, whatever. That is not the way it is done. You took an oath to take care of people's health first, and that is what you should do. And then I can't sell this thing to you. You need to treat your. I had to recommend products for her. I don't have any of the products. I had to like write them out, send her a picture of the product, find these products, do this routine, repair your barrier. No actives on your face for now. No single actives, as little as niacinamide. No active on your face. The only thing that should be on your face, the only thing there is just centella and ceramides that will just help to heal it. Do you understand? Just go and do this. Repair your barrier. After repairing your barrier, you now know which is which. Because most of the acne on your face, I believe, is from your impaired barrier. That is where it's coming from. Now, I have a question. Like, just a very simple question. Skintivity, or I don't know, I mean skin vitality, I don't know. I think Skintivity or something, they say it's Skin 1000, they're on Instagram. It's a very big aesthetic clinic in this Lagos. I have a question for you guys. Do you train your employees? Do you guys have a license? Are your workers, are your employees dermatologists? Are they pharmacists? Are they medical? What are they exactly? I want to know. What are they? Do you train them? Even if because how can somebody that went through medical school or went through pharmaceutical school look through those ingredients and not know the possible interaction between them and not even understand the possible side effects and then recommend it to do you want to kill the girl? Was that a plan? Because I really need to know, because it is really, really important for us to know. I get that, yeah, skincare is just like, because it's not ingested, because it's just like cosmetic, because it's not ingested. These are medications. There's a reason why there's cosmetic and there's cosmeceuticals. In case you don't understand it, there's a reason why there's cosmetic and there's cosmeceuticals. Cosmeceuticals is like combination of pharmaceuticals with cosmetic. Cosmetics actually just for you to be beautiful. It's just something you put temporarily to be beautiful. Cosmeceuticals are cosmetic that contain pharmaceutical ingredients. There is a reason why you call it active ingredients, APIs. APIs are pharmacological. They have an effect. And anything that has an effect has an adverse effect. Do you understand that? So who do you employ? How do you train them? Why are you treating people's skin with so much carelessness? The lady didn't allow me to snap her face. I'm not trying to call out a brand or do anything wrong, but can we all be careful, please? And you guys generally, you people, say small sense, I swear down. Because how can somebody that did not even pass chemistry in secondary school be giving you advice or be giving you products to use? Or you need your face for the person. Fine, there are people that go and train. In this Nigeria, people go and train. Do you know they used to do training like in one boy on people's skin? You didn't go to medical school, but I'm going to keep quiet. But for real, it is appalling. Like, it is really, really appalling with what I am actually seeing. Like, and this Lagos, like, I don't even know whether to pity you people or even not to pity you guys. Because, come on, if it's not expensive, it's not working. That's why you go to clinic and pay 200k for somebody to destroy your face. At some point, I'm like, it fit all of you guys like that. But no, come to pharmacy. I make recommendation. I tell you, okay, you can actually pay me to coach you or to like help you with your skin, treat your skin. 50k, no, it's a problem. But you can't do one day 200k for your face to be destroyed. But 50k for a month is a very, very big deal. No problem. You go online, you see somebody use a product. Some of them don't even use the product. It's PR. It's PR. You go and buy the product, destroy your face, and you're looking for who to blame. Like, see, our problem in this Nigeria, see, hi. Oh my God, I'm talking too much. I'm going. Anything you guys want to do to your face, feel free. If you want to go to somewhere they will burn your face, feel free. All I know is that all of us will be all right. And these aesthetic clinics, you guys, you will reap what you're sowing, because this is really, really unfair. Like, for what reason? For money. For money. It's fine. I'm signing out, guys. See your favorite pharmacist and skincare therapist. Bye.